everyone, I'm Zwella Abutan, a second-year nursing student under Section A5. Now I'll be demonstrating the female catheterization, so I hope that you'll listen till the end of the video. Now, before the catheter insertion, we have to prepare the patient, and there are a lot of things to follow with that. First is we have to verify the order. In verifying the order, we have to check the MAR, or the medical administration record of the patient. Take a look at it and make sure that we will be administering the medication effectively. Next is we have to prepare the materials needed, which are the catheterization kit, urine bag, sterile forceps, iodine solution, alcohol pads as an alternative for soap towelette, syringe, cotton balls, the drape, underpad, sterile gloves, and lastly is the petroleum jelly as an alternative for lubricant. Now next is we have to identify the patient, explain the procedure, and ask for iodine allergies. Okay, so hi ma'am, good morning. May I know your name please?
Amy Rodriguez.
Okay, how about your birthday ma'am?
May 16.
Okay. So, good morning, Mrs. Rodriguez. I am Zwella, your nurse for today, and I will be doing the catheterization. Okay, so ma'am, for your information, this is a procedure where I will insert a tube in your vagina. Okay, so this may be a little bit uncomfortable for you, but this serves a purpose in order for your urine to drain in your bladder. Okay? Ma'am, before we proceed, may I ask if do you have iodine allergies?
None.
Okay, that's good to know if you don't have any. Now, next is we have to ensure the privacy of the patient as well as the good lighting in order for us to see clearer in this procedure. Also, we have to position the patient and assist her in a recumbent position where her knees are being flexed and her feet flat on the bed. Alright ma'am, so can you bend your knees please? That's wide open ma'am. Thank you. Make sure to perform hand hygiene, don clean gloves, and after that is we have to cleanse the perineal area of the patient with soap and water, then rinse and dry. Now, after cleansing our patient's perineal area, we have to remove our gloves. And then we have to perform hand hygiene. Since our gloves is already contaminated and is exposed, we have to, and it is necessary to replace our gloves with a new one and a sterile one. Now, during insertion, we have to maintain the sterile technique in draping the patient. Now, I already opened the sterile catheterization kit on a clean bedside table. I already have my sterile gloves and I'm already done in draping the patient.
Then pick the underpad. Ask the patient to raise her hips and slide the drape under the patient's buttocks. Afterwards is to pick the fenestrated drape and place over the perineum with a hole over the labia. Now, in preparation of the materials, we have to prepare the antiseptic solution using the iodine swab or cotton balls with iodine using a sterile forceps. Then, to attach the saline-filled syringe to the side port of the catheter and inflate the balloon. After that is to deflate the balloon and leave the syringe connected to the port. we have to apply the sterile lubricant to the first 2.5 to 5 centimeters or 1 to 2 inches of the catheter tip. Attach the catheter to the drainage system and ensure that the drainage bag emptying port is being clamped. After that is to bring the kit to the sterile field between the patient's legs. Now in preparation of the urethral meatus, with our non-dominant hand, we have to identify the meatus by retracting the labia. We have to hold this position throughout the whole procedure. Also, with our sterile dominant hand, we have to clean the meatus with the antiseptic solution, moving from top to the bottom. And then allow the antiseptic to dry afterwards. Moving on, in inserting the catheter, we have to ask the patient to bear down. With our sterile dominant hand, we have to slowly insert the catheter into the urethra of the patient until urine flows. Then advance the catheter 1 to 2 inches more. Take note that we do not have to force the catheter through the urethra. And while inserting, we have to ask the patient to take slow, deep breaths until the initial discomfort has passed. Hold the catheter with our non-dominant hand and use the sterile dominant hand to fully inflate the catheter balloon. Remove the syringe afterwards. Gently pull the catheter until resistance is felt. Next is to secure the catheter on patient's inner thigh with securement device, or what we call the strap or the plaster. Make sure the tubing is not kinked and secure the drainage bag to the bed frame below the bladder level and not resting on the floor.
Now, after the procedure, we have to dispose the used supplies, place the syringe in a sharps container, and then remove the gloves. Then after that is we have to assist the patient in a comfortable position, and then we perform hand hygiene. Now, after doing the procedure, we have to document the type and the size of the catheter and the balloon, as well as the amount of fluid inserted in the balloon, the patient's reaction to the procedure, the amount and characteristics of the urine, the name of the person performing the insertion, as well as the time and the day that it was completed. So that's it. It's the end of the video. I hope that you learned something with this demonstration. Once again, this is Ruella Abuton, and thank you for watching.
I was like 16, baby, when you called me up. Just a little extreme, just a little out of touch.